Is Colon Cancer Awareness Month. Colorectal cancer affects men and women of all racial and ethnic groups.
It is most often found in people aged 50 or older, but it can affect much younger people, which is why everyone should know the symptoms. Shelley Botat has more in Health Watch.
According to the CDC, colorectal cancer is the second leading cancer killer in the United States, but it doesn't have to be. Colonoscopies can find polyps before they turn into cancer and also find cancer at an early stage when treatment often leads to cure. You can't tell, but Kari Hagenow is having chemotherapy while she shops.
It's annoying.
The chemo medicine and pump are in the bag, and it's hooked to a port in her chest. Kari's had to wear it 3 days every 2 weeks for the last 6 months.
The fact that we went chemo that route, I'm feeling really good about that.
Last May, Kari was having some issues, including blood in her stool, but being only 28.
I was having more frequent bowel movements, which I didn't think anything of at the time. I was training for a half marathon, and I was like, hey, my metabolism's speeding up.
Kari decided to go to her doctor at Aurora BayCare Medical Center, who sent her to gastroenterologist Dr. Cristescu, who suggested she have a colonoscopy.
It was clearly that there is a fairly large tumor there and was blocking the inside of the colon.
Kari had stage 2 colon cancer.
It was the last thing I would have ever expected.
A couple of days later, Kari was in surgery having the tumor removed.
Her prognosis is very good.
Symptoms of colon cancer include
blood in the stool, changing bowel habits, abdominal pain.
If you have any of these symptoms, Dr. Cristescu says you should see your doctor.
Eventually, it can spread to other organs, and that can be a terminal condition eventually if it's left untreated.
Following the recommended colon cancer screening guidelines for getting a colonoscopy is also important.
Colon cancer screening, I think, has been very effective in decreasing the incidence of colon cancer and decreasing the mortality from colon cancer.
Surviving cancer has changed Kari, and she's excited about the future.
There's a lot of little stuff that I don't think I'll let bother me anymore.
The American Cancer Society recommends regular screening for colorectal cancer should begin at age 50 for people of average risk. People at higher risk should begin screening at a younger age. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.
Thank you, Shelley. Treating autism